You're watching Let's Chat. We now get to spend a few minutes with some of our friends from UTC, specifically the School of Nursing. And this is Dr. Kristi Wick, and Dr. Wick is the Assistant Professor of Nursing at UTC. Is that right?
It is.
Good to see you, Dr. Wick.
Nice to see you. Thank you for having me.
You guys have got a lot going on at the nursing department. Before we get into more of the meat and potatoes here, give me the overview of the nursing school at UTC. How big is it, and what all do you cover?
It is big, but it's growing, which is so super exciting. We have added several programs over the last couple years, so someone can start with a RN and move to BSN, do their undergraduate work through our BSN program, and then we have multiple doctorate programs. So we'll be adding a psychiatric mental health nurse practitioner program soon.
You have talked about adding a couple of new programs just over the past 2 years. Mm-hmm. Give me one and why you think it was so badly needed at UTC.
Oh goodness. Well, the accelerated Bachelor of Science in Nursing degree is incredibly important. We take all of the things that people learn in a normal 4-year degree and squinch it up for those so they can practice within the year. And that gets our workforce up and moving, and it allows us to really change some lives, both of the people who are going through nursing school and the community.
I'm hearing a lot about this thing called the MobileMOC.
Yes.
All right, Dr. Kristi, what is the MobileMOC?
So the MobileMOC is a mobile health unit, medical outreach unit. It is a vessel by which we will extend services to older adults and caregivers in our rural communities.
Why is having something like that so vitally important?
It is really tough to get care when you live out in a rural community, especially if transportation is limited, and being able to help people age in place in their area where they work, live, and play is incredibly important. And so we've assembled an interprofessional team to do just that.
And with so many things, or should I say like so many things, timing is critical. You can help literally save someone's life with the use of this MobileMOC.
We can, and more importantly, we can help them build their journey. So making sure that they're accomplishing what matters most to them day in and day out, and able to stay at home as long and as independently as possible.
And not only is this helpful to the patient, it's got to be extremely helpful to the patient's families as well.
Absolutely. Caregivers is really what makes our MobileMOC unique as well, is not only are we serving older adults, but one of our target population is that caregiver, that person who's working during the day, taking care of children, but also trying to take care of their parents in their life or a family friend.
You know, a lot of times folks tend to not properly give medical professionals the credit they're due when it comes to treating beyond the patient itself, the patient themselves. By extension, the doctors, the nurses, they treat the families, and that can be such a help.
Absolutely, it is for sure. And we depend on families and people in the community, churches, volunteers, to rally around our older adults and to really help with some critical services.
So that's how it helps the older adults. How does it help the students at the nursing program?
Well, everybody is very excited. It's not just nursing, it's students across our health disciplines. They are able to take what they learn in the classroom and see it in action in the community. Not only that, they're able to build relationships, and that hopefully will help encourage them to return and practice in those rural communities.
You mentioned a moment ago about the need for support and about the need for volunteers. If someone has a few hours a week that they can donate, how do they make arrangements to do that?
We would love to have some volunteers out in the community with us. We also partner with the Area Agency on Aging, Southeast Tennessee, and do a lot of work through the senior centers.
Right.
And there is lots of work and fun that can be had at a senior center.
Dr. Kristi Wick, thank you so much for joining us. We do hope you'll come back.
Yes.
We hope you will come back. Again, here's the website if you'd like more information, and we would like for you to stick around. There is more of Let's Chat after this. Hey.